Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be doing a mind map of Alzheimer's disease, okay? But first, if you could hit that subscribe button, it would be greatly appreciated, as it is a free way to support my channel so it can reach more people. So let's get started, guys. So Alzheimer's disease, what is it? So it's the most common type of dementia. So dementia is a progressive neurological disease which affects multiple brain functions, including the memory. So we're going to be going over these signs and symptoms. So there is early signs, mid-stage signs, and later symptoms, okay, that they will go through. So we're going to go through each stage, starting with the early stage. So in the early stages, you will notice the patient starts to forget recent conversation or events, or misplace items. They may forget the names or places of objects, or having trouble thinking of the right word. They may repeat themselves regularly, such as asking the same question several times. They may show poor judgment or find it hard to make decisions, and they may become less flexible and more hesitant to try new things. Now, the middle stage, okay? Once the patients hit the middle stage, you'll start noticing these signs and symptoms, such as increased confusion or disorientation. They may become obsessive, repetitive, or even have impulsive behavior. They may have delusions, so believing things that are untrue, or feel paranoid. They may have problems with speech or language, so they may just not speak. They may have disturbed sleep or mood changes, so frequent mood swings, depression, or even feeling more anxious, frustrated, or even agitated. And they may even experience hallucinations. Now, in the later phases, what will we see? So they may experience difficulty eating or swallowing, difficulty changing positions or moving around without assistance. They will experience considerable weight loss, unintentional pass of urine or stool. They gradually will lose speech, and they will have significant problems with short and long-term memory. So I have put this mind map in kind of a 2-page. So you just seen the last page, and now this is the second page. I did that because I wanted to have all the information. Most of the time, I like these mind maps to just be 1 page. But with Alzheimer's disease, I wanted to make sure you had all the information, and especially on the last page, to differentiate the different stages. So now we'll look at the prevention, causes, diagnosis, treatment. So we'll start off with prevention. So the exact cause of Alzheimer's disease is unknown. So there's really no way to prevent the condition. However, there are steps that we can take to help delay the onset of dementia. So quit smoking, not drinking lots amounts of alcohol. We want to eat a healthy, balanced diet. That does include at least 5 portions of fruits and vegetables every day. Exercise for at least 150 minutes, so 2 hours and 30 minutes every week. Now, this is just moderate, intense activity. So cycling, a fast walk, and this will help improve the physical and mental health, and just be sure that the blood pressure is in check and under control. And if you have diabetes, to make sure that you're watching your diet and taking your medications. Now, these are lifestyle changes that are for the better for many, many health conditions, okay? When you start looking at preventative measures, a lot of them intertwine, okay? So really, these help with so many things. So we really should be doing those anyways. Now, under the causes, so let's have a peek at that. Now, once again, we still don't know what really causes dementia and Alzheimer's disease. So what happens is parts of the brain starts shrinking, which does affect the structure and function of the brain areas. Okay, so people have an increased risk when they get older. It kind of comes with age. If they have a family history, if they've had a head injury, cardiovascular disease, and if they have Down syndrome, they're more likely to develop dementia. Now, how is this diagnosed? So either through a CT scan or MRI, and under treatment, there's currently no treatment for Alzheimer's disease, although there is medication available and can temporarily reduce some of the symptoms or slow down the progression in some people. So there is medications that doctors can try with patients. So that's all I have for this video. I hope you did find it helpful. Now, if you are looking to print these off, please do check out my Etsy store. I have it linked down in the description below, and it will be at the end of this video. But that's all I have for this video, guys. I hope you did find it helpful, and I hope you have a wonderful day.